Pelvic organ prolapse is a fairly common condition in women where the pelvic organs such as the uterus, the bladder, and the rectum can drop down into the vagina. That's sometimes referred to as uterine prolapse, cystocele, or rectocele. Pelvic organ prolapse may not cause any symptoms, and if it doesn't cause symptoms, it doesn't really require any treatment. However, in a lot of women, it can be bothersome, and some of the symptoms that it causes are feeling of pelvic pressure, feeling of a lump or a bulge, or sometimes some urinary symptoms such as difficulty urinating completely or difficulty evacuating your bowels. There are a number of risk factors for pelvic organ prolapse. One of the most common is childbirth, particularly vaginal births, and women who've had multiple births or large children may have a higher risk of pelvic organ prolapse. Other risk factors include aging, menopause, chronic constipation, known connective tissue disorders, and a family history of pelvic organ prolapse. Even though there's not a lot of data in the medical literature about prevention, we do know that certain things can be beneficial. For example, pelvic floor muscle exercises, also known as Kegel exercises, can be very helpful for preventing pelvic floor disorders such as pelvic organ prolapse. Other things that can help prevent prolapse are weight loss in women who are overweight and avoiding chronic constipation. Pelvic organ prolapse is not dangerous, so doing nothing is a perfectly reasonable option for lots of women. So particularly if one doesn't really have any symptoms, watching and waiting is one reasonable treatment. There are three other possible treatment options. One is the pelvic floor exercises, also known as Kegel exercises, and those have been shown to be very helpful for treating symptoms of prolapse, particularly if the prolapse is not particularly severe. The other two options are pessaries and surgery. Pessaries are devices that are similar to a diaphragm that are placed in the vagina to lift the uterus or bladder or whatever may be prolapsing. This can be done in the doctor's office, and then the pessary can be managed by the patient or by her healthcare provider. The fourth option is surgery, and there are multiple different ways of doing surgery. Most of them are minimally invasive and can be done as outpatient surgery. There are several options for treating pelvic organ prolapse, and your Mount Sinai provider can help you decide which is best for you.